A new normal has descended upon us, wherein we have learned to connect with the rest of the world in new ways despite the imposed physical isolation. The COVID-19 pandemic has challenged our mental health in more ways than one. The worst affected of all are the survivors of COVID-19. In order to rise above the distressing pandemic situation, we must find ways to mitigate the mental health after effects faced by recovering patients, critical patients, and their families affected by COVID-19. We are Team UI UX. Our take on UMO's Design Challenge 2021 is to tackle clinical communication between critical patients and their families to reduce the stress and emotional challenges they face on their journey through COVID-19. We call it Remocare. Based on our own experiences, we understand the struggles of families affected by COVID-19, the anxiety, stress, and responsibility to care for and support their family members can take a severe toll on their own health. One of the major worries of families and friends supporting a patient is the timely awareness of the patient's health condition. Being isolated from the patient, their ability to help relies significantly on the information that doctors, healthcare professionals, and hospitals provide. With hospitals and doctors being overwhelmed during the pandemic, the transmission of timely and accurate information is impeded. We want to bridge this gap in communication between the family, the patient, and the healthcare system through a mobile application. Remocare is our vision for a simplified clinical communication application between patients and healthcare professionals on one side and the families and relatives on the other. Ajit is currently affected by COVID-19 and has been admitted to the hospital for treatment. He is in intensive care and rarely communicates with his family as he is low on energy. The hospital receives frequent calls from his family to check upon him. This is when the nurse suggests the use of Remocare. She helps install the app on his phone and signs him up through a simple phone number-based login. After registering as a patient, Ajit selects 5 of his closest relatives and friends as emergency contacts. They are sent an invite to join the app via SMS. Once registered, they are given access to Ajit's health updates. Every time the nurse or doctor has a check-in with Ajit, he or she quickly opens the app, scans or snaps his recent medical updates, and shares them with his family through Remocare. Ajit's family is informed of every update, such as his SpO2 levels, test results, medical requirements, etc., through this one app. All his COVID-related medical records are maintained within this one app at the disposal of the family. While it is currently envisioned for use during COVID, it can be expanded for usage for other diseases as well, allowing users to keep track of health records constantly. It can provide a sense of hope for families that feel helpless while facing difficult health situations. By using existing technology, the app has a low cost of implementation. This system can work with private as well as public healthcare systems, as this will not put any burden on their existing infrastructure. Should there be a next wave, we believe Remocare will help put many patients and their families on the path to a comfortable recovery from COVID-19.